On today's episode of the Simply Retirement Podcast, we're going to help you answer the question, now that I've chosen my Medicare plan, how do I maximize my benefits and avoid many of the Medicare mistakes that retirees make? Welcome to another episode of the Simply Retirement Podcast, where we want to educate and empower women to live your retirement on your terms. I'm your host, Eric Blake. Back on episode 28, we discussed the ins and outs of choosing the right Medicare plan. On today's episode, we want to share some tips and strategies on how you can most effectively utilize your Medicare coverage and get the most out of your benefits. Today, I'm going to be joined by Traci Grover, a seasoned insurance broker with Vital Health coverage, who brings a wealth of experience helping retirees avoid some of those common Medicare mistakes. We're going to be talking about enrollment tips, why working with an experienced broker really does matter, what those flashy TV ads aren't telling you. And Traci's even going to share the one thing you should never say when your doctor office asks, what kind of insurance do you have? So if Medicare has felt confusing or overwhelming, you're going to love this conversation. And with that, Traci Grover, welcome to the Simply Retirement Podcast.
Thanks, Eric. Thanks for having me. I appreciate it. And I love being here.
Absolutely. Looking forward to it. And you and I've had this on the radar for quite some time, and I'm glad finally got to make this happen.
Sounds good.
Excellent. So if you don't mind, I would love for you to share just a little bit about your background, what brought you into the Medicare space. I know you've got a story behind that, as most great stories are. So if you would just share a little bit about that, and we'll go from there.
Sure. It's actually a funny story how I got into insurance. So my background is anything from medical devices, medical equipment. At one point, I even owned a Pilates studio for about 6 years. But I call it my last full-time employer job. I worked for a med device company. I ran a small division. I was in charge of sales and operations. And I would train about 100 sales reps across the country who were distributors, but even worked with like a lot of the nurses down at MD Anderson. It was great. But I had a friend. I had 2 young kids, and I wanted to find something part-time. And a friend of mine said, I've got the perfect part-time job for you. And I said, okay, what do you got? Anything but insurance. And we laughed about that. And she said, why do you say that? And I said, it just sounds so confusing and so much to learn. And it's boring. And so I absolutely love what I do. And the reason I love what I do is because it's so confusing and it's hard to navigate. And I truly feel like I am helping the end user, who are my clients on my insurance policies, to help them navigate and alleviate some of that pain for them. So it's kind of a roundabout way, but the more I'm in it, the longer I'm in it anyway, I really love it.
Well, I don't know, you and I have known each other, I know what it is, a couple of years now, probably, and we're part of the same networking groups.
Yes.
And I can definitely see the passion that you have for it. At some of the different networking events and health fairs and different things like that. So I'm glad we've got a chance to get together and know each other a little bit. So let's start with that one, the one I brought up about your doctor's office. So I walk into my doctor's office. I need some type of procedure. I need some type of care. They ask me, well, what kind of insurance do you have? How should I respond to that?
Sure. Well, a lot of times people are calling also to make an appointment. And before, let's say they're a new patient or they're calling to get into an urgent care and they want to say, how long's the wait? I'm not feeling well. So before a doctor or an urgent care facility will even say, oh, the wait's only 30 minutes or 2 hours, or we want you to come in on Friday at 2, they're going to say, what insurance do you have? And so it just depends on if you have an Advantage plan or a Medicare supplement plan, but you always want to lead with that supplement plan or that Advantage plan. If you say at an urgent care, I have Medicare, they're going to say, I'm sorry, we don't take that. And I've had many phone calls, like at 10 o'clock at night, someone's trying to get into a Care Now or another urgent care, and they're so frustrated, they'll say, no one's taking my insurance. And then my first question is, what are you saying? If you say you have Medicare, they're thinking just your red, white, and blue card, and they do not take just original Medicare. They'll take original Medicare with a supplement, Plan F, Plan G, or any supplement, or that MAPD, Medicare Advantage prescription drug plan. So you always want to lead with your supplement plan and Medicare, or I have ABC Company's Advantage plan.
So is that, did you hear this? You hear these issues all the time. Hey, this so-and-so doesn't take my coverage, or they don't take Medicare. Doctor's offices that no longer are taking Medicare. So how much of that when the doctor's office hears, they ask you that question and they hear Medicare, Is it intentional? Is it because they don't want to deal with it? Do you have any insight on what triggers that response?
Well, a lot of doctors don't take original Medicare. They'll take a Medicare with a supplement, Medicare
Okay.
with an Advantage plan, but it really comes down to the billing process, in my opinion. When you're billing just Medicare, you're billing the government to be reimbursed. When you're billing a supplement plan or an Advantage plan, you're billing the carrier. So the carriers have to follow all the rules that Medicare guidelines are giving them.
Okay.
So it's a lot for instance, if you bill a Medicare Advantage plan, those physicians are being reimbursed within usually 45 to 60 days.
Got it.
If you're billing the government, it's going to be about 6 months.
Wow. So one of the other things I wanted to ask you about, and this is you've provided a list of some of the tips and tricks that you talk about in different presentations and things like that that you found have been valuable for your clients. Well, one of the things I want you to share, what happens, we get into these different enrollment periods, and there's all of a sudden seems to be this huge urgency around open enrollment or all these different time frames that people do need to be aware of, but it's often not as urgent as what it's made out to be, either in the news or on some of the TV commercials and things like that. Can you talk about that a little bit?
There's a lot of acronyms that we use for different election periods, and it can become kind of confusing for folks. And I will, in my monthly seminars, I'll talk about those. One of the biggest things that people get confused with AEP, which is annual election period, which I know you guys talked about in your other episode. It's October 15th through December 7th. The only folks that really need to look at AEP are your Medicare Advantage prescription drug plans or your PDPs, your prescription drug plans. But I have people that say, oh my gosh, I'm turning 65 in April and it seems like I have to sign up between October and December. No, you have your own special election or initial election period then. Or I have a supplement and I wanted to change my supplement in April. You can change a supplement any month of the year, but you have to wait until specific election periods to change your prescription drug plan or your Advantage plan.
Because I know even you, when we were talking about, booking our time to do our podcast, that was one of the things. You're incredibly busy. So what is your time, toward in that October to December timeframe? What is it that you're typically doing?
So between October and December, I'm working with all my current clients. We're doing Medicare reviews. We're looking at their drug plans, looking at their Advantage plans. I always say if it's not broken, let's not fix it. If they're happy with what they have, but if they want to say, well, I really needed more of whatever the need is that they have, then we can look at other plans to see what's changing. Every year, the Advantage plans are tweaked a little bit by the carriers. And then I have my own go-tos where some years I like one, two, or three A, B, and C carriers. Another year I might like, just some different ones. And it just depends on how their plans change. It also depends on what those carriers are going through for the next year.
Absolutely.
That is my busy time of the year where I'm working about 12 hours a day, but it's really only for October 15th through December 7th, but also we're prepping for it, in September, getting ready.
So there's a couple of things I would love you to dive deeper into related to what you just said. And that is that you talked about during that window of time, you're doing Medicare reviews. Can you talk a little bit about what that looks like? Because I think that's one of the things, to the point of working with somebody who has the experience, that it's not just I buy my plan and that's it. And it definitely is not a set and forget it type situation.
Sure.
When you talk about that review process, what does that look like, and why? How important is that to individuals who are in that Medicare phase of life?
Absolutely. It's really important. So when I say Medicare reviews, I'm sending out correspondence to all my clients and I'm asking them, are you happy with your plan? Has anything changed with your health care? Have you had any new diagnosis? Have your medications changed? Have your doctors changed? Based on their feedback. So there's going to be clients I don't need to do a Medicare review for. But if someone was recently diagnosed with the heart disease or diabetes, or, now they're in macular degeneration treatment or cancer treatment, whatever it may be, their meds have changed. Now their meds are more expensive. Their doctors changed. Depending on how their health has changed and their needs have changed, tells me if we need to look at another plan that might be better suited for them. But then we also need to make sure there's some chronic plans where I need to make sure that those doctors or new doctors are in those plans as well. Or is there medication on the formulary with the current carrier that we have? So we need to check all that.
Now, one of the, I'm sure you hear this objection, I know I hear it, is in terms of cost. Thinking about, okay, well, if I'm paying X amount from a Medicare plan, well, if I go to a broker, is that going to cost me more? How much more is it going to cost me to use somebody like you, again, who has that experience? Can you talk about that to clarify exactly what the cost structure is when you're working with a broker versus not working with a broker?
Sure. So I've been a captive agent with a carrier before, and I'm a broker now. And as a broker or a captive agent, our cost to our clients should not be it should not be anything because we're paid only by the carriers. So we're not charging a cost to do what we should be doing anyway. So the only way that I get paid is if I sign somebody up under me, then I'm assigned their agent of record. The carrier then pays me for being their agent of record.
So there really is not much of a cost difference in terms of whether you do or don't use a broker.
There should be zero cost difference. Correct.
So for then, you're thinking about why you would not use one. I guess I'm not sure. Is there any reason why somebody wouldn't use a broker unless they just had the experience themselves?
Well, even if they have the experience themselves, because I do have a couple clients that have a lot of experience, but they're not always abreast of what's new, what's coming down the line, where we're getting correspondence constantly from the carriers of new plans that are coming, new regulations that are coming. It's just keeping us more abreast of everything. But the benefit of using a broker, in my opinion, is, I have access to all the different carriers that provide different plans and possibilities here in whichever area they live because I'm in 19 different states. So it helps me to have a broader, I guess, gamut of options for them. If I'm not a broker and I'm just with one carrier, I'm very limited on what I can provide.
So can you talk about that? One of the things that often happens is people are getting close to retirement. Maybe they're in their early 60s, they plan to retire 65 or 67. But one of the questions always comes up is, should I move? Should I move to a different state? Can you talk about how that works or how you help clients navigate those types of decisions on going from one state to another? Even you and I talked about, kind of went back and forth recently about a client that she's currently in Florida, but she may be moving to Tennessee, both states which you're licensed in.
Right.
But those are pretty important decisions, correct?
Sure. Well, a lot of times when people retire, I've had people say, we're going to buy an RV and travel the country, or we're going to live half the year here and half the year in another state because we have children over there, or we've always been interested in whatever state they're interested in. So my motto, and the reason I'm licensed in 19 different states now, soon to be 20, is I've always told my clients, if you move or if you have a relative or a friend that wants to work with me, because I'm a pretty hands-on broker, I will then become licensed where you're going. It's very easy for brokers to get licensed in other states. It's just a matter of the upkeep. So as I have people saying, well, I have a gentleman right now. He was living in Texas. He's moving to North Carolina, but he also has family in New Jersey and in Virginia. So he wants to know, will I be able to help him if I'm in those different states? So that's kind of like when you think about, well, what am I going to do when I retire? Some people say, we're not going anywhere. We're going to stay right here. Our family's right here. Other people say, you know what? I want to get up every day and see the mountains or walk on the beach or whatever it may be, or I want to travel in an RV. And their lifestyle and their personality helps me determine what's going to be the best plan for them. And the reason I say personality is I like to ask people, tell me about, when you go to the doctor, are you okay with choosing a doctor in a network? Or do you want to find a doctor on your own because you've read reviews on them? That is a personality trait, which I actually feel like I have too. I don't want to be told, well, I've got to go to A, B, or C doctor. What if I want to go to one of these other ones? So then it helps me figure out, do we need an HMO, a PPO for Advantage plans, or do we need a supplement plan?
And again, that still comes back to me as the value of a broker, of understanding that, unfortunately, so many people will look for the cheapest plan,
Hmm.
regardless of what their circumstances are going to be today or what they think they're going to be in the future. And then they end up getting maybe caught with a plan that just doesn't meet their needs within a short amount of time.
Yeah.
And I think that's one of the things that, again, you could probably help with because, the challenge of not having whether it's no underwriting, those types of things. Can you talk a little bit about that? What happens if I all of a sudden within a couple of years, I figure out that this wasn't the right plan and I need to think about changing? What are some of the key points or tips you would suggest in a case like that?
Well, it happens all the time. So, and sometimes it is trial and error, but the good news is if I'm working with you and we're staying on top of what's going on with your health and your needs and what you like, what you don't like. But I always joke with folks when I'm doing a presentation, I always say, we're not going to pick a plan because your neighbor down the street likes their plan. So you want to look at their plan, or we're not going to pick a plan because you and your spouse want to be on the same plan where if one person's completely fine, goes to the doctor once a year and the other one has heart trouble and diabetes, we're not going to probably put them on the same plan. So, and then unless we're putting them on the same supplement plan, and that's a whole different story. So then we got to figure out, okay, what's their lifestyle? Tell me about where you're going, and then also affordability.
Absolutely. Again, I think it's one of those things again that you would love to get it right the first time, but it becomes so challenging. Number one, because the life simply happens and you just don't know what the future holds.
And yes, and one of the things that I really like to talk about is I don't want people to, when you think about a plan when you're 65 versus a plan when you're 70, 75, 80, your needs are going to change. It's not a one and done. So I always tell people, we're not going to just sign up and then we're going to be on that same plan until we pass away. Yes, you could, especially if you sign up for a Plan F or Plan G Medicare supplement plan. But a lot of folks need to still tweak and change. They might need to change their dental or their vision and hearing plan. There's a lot of ancillary plans that we can look into, like a cancer, heart attack, or stroke plan, or hospital indemnity or a max out of pocket. So there's a whole bunch of different things that we can do, but it's really beneficial. If you have a supplement plan, you want to sit down and kind of review that with a broker, usually every 2 to 3 years, in my opinion. If your rate is going up more than $25 a year, because those plans do go up, and that's a monthly rate. So if your monthly rate is now more than $25 from where you started, we want to look at that and see if there's something that we can do. You can certainly change your supplement plans. You just have to answer medical questions after you're past your initial plan. The Advantage plans, they don't ever ask any medical questions, so we can change them anytime. And those plans, we really want to look at those every year. Some people say, well, I don't need any dental this year, but next year I'm going to need dentures. Does my plan help pay for that? So and it could be next year I need a shoulder replacement. I don't want to spend a lot of money when I'm in the hospital. All different things. There's 1,000 different types of scenarios that we can look at.
Awesome. One of the things I know that also confuses a lot of people is the prescription part of all this.
Mm-hmm.
Can you talk a little bit about that? In terms of whether you've got, hey, this plan covers everything from A to Z, including prescriptions, versus having a separate prescription plan. Can you kind of talk about the details there?
So it's a little bit of a beast right now. The Inflation Reduction Act just went into effect January of this year. So the good news is, nobody's going to spend more than $2,000 on their medications. But the big thing that's important to know is people just say, well, I thought I didn't have to spend more than $2,000. It's $2,000 for your co-pays of your prescription. That doesn't include the premium of your prescription. And it's only $2,000 if your drugs are on that carrier's formulary. So a lot of times, it will not be $2,000 if you're suddenly put on a drug that's not on that formulary. All carriers change their formularies. The good news, they're typically trying to add prescriptions or drugs to their formulary. But if you're suddenly put on a drug that is not on that formulary, you're going to be paying out of pocket for it. So you're going to definitely go over, or maybe you won't if it's an inexpensive prescription. But if you're on an expensive one, it's not even going to be counted into that $2,000 max. So prescriptions right now, every year, I am teaching my clients how to but go into Medicare.gov and actually help do their search for their prescriptions. We have to be very specific. I need the name of the drug, the dosage amount, how many pills a day or injections or whatever it may be. Also, if it's a brand versus a generic, and so we're not going to list any over the counter. I had someone recently give me an entire list of drugs and 90% of them were over the counter. I can't do anything with those because you're walking into Walmart and buying those. So we're just looking for the ones you're filling from the pharmacy. I'm comparing if they are in that formulary, but I'm also teaching my clients how to do that now. And there are a lot of folks, a lot of agents like myself or brokers that are moving away from working with the prescriptions. It'll be interesting to see how it pans out towards the end of the year. But I'm teaching a lot of folks how to look it up themselves as well. So they're staying abreast of it. And then there's little tricks, like, I know, and this is silly, but I talk about this as well. I don't know why it's like this with eye drops, but sometimes I had one lady on an eye drop that was zero point 0.5 whatever it was, milligrams, milliliters. And it was maybe $3 a month. The doctor said, you know what? You don't need the zero point 0.5 anymore. We're going to move you to the 0.25. When she went to fill that prescription, it was $104. So then she called me and she said, what's going on with this insurance? And I said, I think you're filling a drug that's probably not filled very often because it's more common to fill the 0.5. So she called her doctor and he said, well, if it's that much, then yeah, just use the 0.5, but use it half the amount of time. Now, I'm not a doctor. I'm not saying, I can't tell clients what to do. They always got to follow up with their physician. But it was just interesting how the difference in that same drug with a different dosage amount was so much more costly.
Are there any other thinking along those lines of these little tips and tricks people just wouldn't think about normally
Yeah.
that somebody like you can bring to the table? Or do you need those little old things that might save some dollars, save some time?
Staying with the prescriptions, I always teach my clients when you go, this is a little tedious, but when you go to pick up your prescriptions at the pharmacy, ask him or her, the pharmacist, three things. Okay, let's go over each one of my drugs that I'm picking up. How much is it on my insurance? How much is it if I self-pay? And how much is it if we use one of these discount cards? And even I'm on my husband's insurance, but even when I go pick them up, I'll say, okay, ring these two prescriptions up on my insurance. I'll self-pay for this one. And then this other one, I'm going to pay with that prescription card, just because it can save you money. Great example is a tier 2 with a company is usually, anywhere from $0 to $14, depending on the prescription. But maybe let's just say it's $14. So you pick it up, it's a tier 2, you're running it through your through your carrier, and you're going to pay $14 for it. But maybe if you self-pay, it's only $8. So if you self-pay, it'll be a little bit less out of your pocket. Not many people want to go through that. They're like, here's my card, let me ring it up. But for the people that want to, it's almost like a little bit of clipping coupons, I always say. But it only takes 30 seconds to ask. Unless you're picking up like 45, prescriptions, but if you're just picking up one or two, it's really easy to say, how much is it on my insurance? How much is it if I self-pay? And how much is it on a discount card?
I think that's hugely valuable. We always talk about when you're talking about, especially when you're in your retirement years, if you're on a limited income and you're just trying to maximize every dollar, it may be worth the extra, 30 seconds, 60, a minute to go through that process and just to save a little bit of money. I think that's great.
Yeah, it works. I have a lot of people doing it.
Hey, that's a good thing. It means your message is being communicated effectively.
I hope so. I don't know. I hope so.
Yeah. So if you would, I think it's always important when we're talking about Medicare to cover some of the key deadlines, as far as, when you turn 65, or if you continue to work, there's so many that are now continuing to work beyond 65. If you wouldn't mind, just touch on some of those key deadlines. We touched on the open enrollment period already. If you want to go back and just quickly revisit that, but some of those important deadlines as to when I need to actually get my application in.
So a lot of people get nervous. They think, oh my gosh, I'm turning 65. I'm still working. I need to sign up for A and B. You do not need to do that. It would be great if you can sign up for A. If you're still working and you're turning 65, you're going to stay. And let me just say this. If you're still working and you're going to stay on your employer insurance, then you can sign up for A and delay B. If you've lived in the U.S., and worked here for 10 years, if you're a U.S. citizen, A isn't going to cost you anything. So you can sign up for A. A covers hospital. And it kind of lets the government know, hey, he or she is still working. So sign up for A and delay B. If you need the link, people will call me and say, I'm getting ready to turn 65. What do I do? And I always say, you don't even have to think about this. Just call me when you're getting close to that. I send you the government link to sign up for A, and you're delaying B, and you're going to just keep going about working. When you're ready to retire, I'm going to send you the link to sign up for Medicare Part B as in boy. And then once you have B active, and then we're going to put you on either a Medicare supplement plan with a drug plan, a dental, vision, and hearing plan, possibly a cancer, heart attack, or stroke plan if you need it, whatever else you may need. And then, or that Medicare Advantage plan with maybe a hospital indemnity plan. But, they don't really need to think about it as long as they're keeping in touch with me. So I'm working with several folks that say, oh, hey, Traci, I'm getting ready to turn 65. I don't know yet if I'm going to retire. So if I do, it'll be by the end of the year, but I'm turning 65 in May. What do I do? So I'll say, let's just start with signing up for A. And then once you decide when you're ready to retire, then I'm going to send you the link to sign up for B. Then I'm going to follow you until we know it's active in the system. And then we're going to get you set up on all the, specific plans that you may need. So there isn't really like an acronym. So your initial election period, I guess, is when there is an acronym. When you sign up,
there's always an acronym.
There's always an acronym. You have technically 7 months when you're turning 65 if you need it. But really, if you're just going to sign up for A, we're just signing up for A and we're going about our business. Then once you retire, you're going to have 8 months to sign up for Part B. But this is funny. You have 8 months to sign up for B, but once your prescription drug plan ends, you only have 63 days to sign up for Part D as in drug. That's your drug plan. But as long as they're following up with me, I'm going to keep them on track for that. So we have deadlines. You have, when you're turning 65, sign up for A and B, or sign up for A, delay B. And then once we get all that going, when your insurance is about to end with whatever you have, we're going to get you to start what's going to be seamless. You're going to end one insurance at midnight on one night. You're going to begin the next one at 12:01. That's, following day. With that drug plan is also, you only have 63 days. And people always say, why do I need a drug plan? I don't take any prescriptions, which is fabulous. But the government believes that at some point after you turn 65, everyone's going to need some sort of prescription. Even if you're on a Z-Pack for a sinus infection, you will need a prescription for something. So you have 63 days to sign up for a drug plan once you do not have a drug plan. If you have a valid drug plan, that's great. Another thing that's really important to know is COBRA is not considered credible coverage by Medicare. So I had a gentleman recently retire, and he said, good news. I took an early retirement package, me and several other people. This gentleman happened to be 68. Another person that took the early retirement happened to be 45. They both got a year and a half of COBRA covered by the company. And that's great for the 45-year-old. It's pretty good for the 68-year-old too. However, if he and his wife, who happen to both be over 65, they're going to get what we call a late enrollment penalty if they don't sign up. Now, it's not that much money. Some people say, I'm fine with the late enrollment penalty because I have COBRA paying for me for 18 months. And the late enrollment penalty is only going to be, so much amount, but it's going to be so much amount every month for the rest of their life.
Right.
But it's just a matter of weighing the cost, and he was fine with that. So that worked out well. But for some people, they're like, no, I don't even want a 50 cent, in penalty because it's 50 cents every month for the rest of my life.
Well, I'm so glad you brought that up because that is one of those big got yous that people don't really realize if you're going to be retiring before 65, you got to make sure ideally you have a plan going into that so that you know what your strategy is going to be around healthcare. One other thing I was going to touch on, and you touched about enrolling in Part A at 65 if you're going to continue to work. The only thing I would one caveat to that I would throw out there is HSAs. So
Yes.
If you're going to be continuing to contribute to your HSA, and that's one of the things we almost always encourage clients to do, you have to have access, is if you're contributing to your HSA, I mean, it is the triple whammy of tax planning, I call it, because you get pre-tax, tax deferred, and tax-free if you use it the correct way.
Yes.
But you cannot be contributing to an HSA and be in Medicare Part A even. So just one of those things that you want to be prepared for. And I mean, it's 6 months prior to enrolling in Medicare that you need to stop all HSA contributions. Anything else you would add to that?
Well, I'm glad you brought that up because I always tell folks in my presentations that I want them to refer back to their financial planners, back to their CPAs. If they do have an HSA, especially follow up with your financial planner because isn't it if you're older than 65, you actually need to stop that HSA 6 months before you sign up for A and B.
Right.
And then if you're taking it at 65, you have to stop 1 month before 65. But if you want to stay in that HSA plan, I totally will tell them you need to talk to Eric before you work with me. So you're the specialist with the HSAs.
I appreciate that. Well, Traci, this has been incredibly informative. If someone listening today wanted to reach out to you, learn more about your services, how can they get in touch with you?
Okay, great. So my website is vitalhealthcoverage.com. And then my cell phone, which is directly to me, is 214-945-7359. And then you can also email me at tracigrover@gmail. But my name is TRACI GRO, V as in Victor, ER at gmail.com.
Well, perfect. Traci, thank you so much. Thank you so much for joining today. Your insights on Medicare and some of these little tips and tricks our audience can use to more effectively manage their Medicare are invaluable. I know our listeners will benefit from everything that you've shared. To our listeners, if today's episode has resonated with you, I encourage you to check out Traci's website, learn more about how she can help you navigate Medicare. As always, if you're looking for guidance on retirement planning, tax strategies, and making sure that your financial future is secure, feel free to reach out to us at blakewealthmanagement.com. You can find more information about that on our website. For more resources and links to this episode, you can go to www.thesimply.retirementpodcast.com. Until next time, please remember, retirement is not the end of the road. It is the start of a new journey.
That's it for today's episode of the Simply Retirement Podcast. We hope you found our insights and advice helpful in planning for a fulfilling retirement. Don't forget to take action on what you've learned today. Visit our website at blakewealthmanagement.com to learn more about our firm and review our Simply Retirement Roadmap process to get you on the right path to the retirement you deserve. And don't forget to click the follow button to be notified when new episodes become available. Thank you for joining us on this journey, and we look forward to helping you achieve your retirement goals. Remember, retirement is not the end of the road. It is the start of a new journey. So embrace it and make the most of it. Until next time, take care. Content here is for illustrative purposes and general information only. It is not legal, tax, or individualized financial advice, nor is it a recommendation to buy, sell, or hold any specific security, or engage in any specific trading strategy. Results will vary. Past performance is no indication of future results or success. Market conditions change continuously. This commentary reflects the personal opinions, viewpoints, and analyses of Blake Wealth Management. It does not necessarily represent those of RFG Advisory, their clients, or their employees. This commentary should not be regarded as a description of advisory services provided by Blake Wealth Management or RFG Advisory, or performance returns of any client. The views reflected in the commentary are subject to change at any time without notice. Advisory services offered by investment advisory representatives of RFG Advisory, a registered investment advisor, Blake Wealth Management, and RFG Advisory are unaffiliated entities. Advisory services are only offered to clients or prospective clients where RFG Advisory and its representatives are properly licensed or exempt from licensure. No advisory services may be rendered by RFG Advisory unless a client agreement is in place.